Good afternoon, everybody, and welcome back to Procrastinator's Pit Stop. I am here again with another amazing guest, Dr. Evelyn Higgins. Evelyn is the founder of Wired for Addiction and Wired Biohealth, a retired physician, certified addictionologist, and Olympian team doctor, whose groundbreaking work integrates addiction science with mental health biomarkers and epigenetics to promote holistic wellness. Evelyn, welcome to the show.
Thank you for having me, Chris. It's my pleasure.
It's my pleasure to have you on the show as well, because as we know, with procrastination, addiction does go hand in hand, and we have a lot of interesting ground that we can cover today. Before we do that, we do like to have an icebreaker on the show, and the question for you today is, which cartoon character do you resonate with the most, and why?
So growing up, I loved the Peanuts gang, the Charlie Brown kids. I would want to make it a hybrid, if I can, between Lucy, Linus, and Charlie Brown himself, because they all brought something really good to the table, and then as human cartoon kids, they also all had their downside, right? So if we could take the best of the three of those, that would be a really, really great character, I think.
No, yeah, I like that. Going back a bit, but you Charlie Brown with his, I guess over planning, being anxious or whatever, right? But he's dependable.
Yeah.
Then Lucy was the 5-cent psychiatrist, right?
Yeah, exactly. The psychiatrist.
5 cents. Wow.
Yeah. Good memory, Chris.
Yeah, well, I did watch the movie a little while back. I don't know. The movie was 2021 or 2022, I think.
Yeah, maybe.
They did the remake.
Yeah, the remake. Yeah.
No, but I like that one. I like that one. Sliding easy into it. How do you define procrastination, Evelyn, and what does it mean to you personally?
Sure, great question. Procrastination is just, to me, it's knowing that a task needs to be completed and doing everything within your power not to make that happen. The biggest part of procrastination is the effect of what it does to you psychologically, beyond just the not getting that activity done, but the psychological part of shame, guilt, all those things that are behind it. And it makes it so much harder than just getting it done. And that would be easy if you could just say to somebody, just get it done. They'd say, I'd love to if I could. Right? Mm-hmm. And how that intertwines with addiction, really, when we look at the brain chemical dopamine, and that's our brain reward cascade. That's our pleasure center. So you think about when we complete a task, what happens is our dopamine actually spikes. That's why we feel so good when we complete that task. So then you'd say, so why, you're going to feel good, so why are you procrastinating to get there? And from the work that we do at Wired for Addiction, Wired Biohealth, where we would see somebody with low dopamine, and they don't have enough in the tank to say, okay, I can get there and get that done. And then beyond that, there's other layers that we look at from the genetic standpoint of if someone has a biomarker or a gene that doesn't convert that dopamine, that's going to be problematic for them until we say, okay, what do we need to do to optimize this individual?
I like that in there. You had a lot of great information, and there's a couple of threads I definitely want to pull out in there.
Sure.
The first one is that, I love how you said that, if somebody wanted to get it done, and they could get it done, they would get it done. Because so many times we sit at somebody and we say, oh, you're lazy. Oh, what's going on? You're worthless. Like I asked you to do this on Tuesday. Why didn't you do it? It's now, Saturday or whatever.
Right.
But yeah, that's the real key. If they wanted to and were able to, they would. So I really like that you brought that up. The next thing I kind of want to dig into when you're talking dopamine and the addictions here, especially like addictions are near and dear to me as well as everybody who knows me. Because I was a high-functioning alcoholic, and I can understand different things. I understand my own, right? But would you say that with the dopamine receptors, this has always been a question of mine. People who use like cannabis, alcohol, any of those sort of like light gateway style drugs, are they like their dopamine receptors? Do they get like blocked or rewired, or does it stay the same?
Great question. It's case by case, really. Because we go through so many layers of what's happening in that person's unique physiology, we can get to the point of getting those receptors to function again, for the most part. Clearly I'd say 9 out of 10. That's not putting a Band-Aid on something. That's going through all the layers of what's happening here. Like I said, the first part is, measuring somebody's dopamine. Do we have enough? Do we have too little? If we don't have enough, we seek what we call clinical correlations. Okay, this is what we see in that individual. It looks like urges. It looks like impulses. It looks like cravings and addictions. So, okay, you can identify they don't have enough dopamine as their starting point, but then we have to look deeper into the genetic part and say, can they convert dopamine? So there's so many layers to what's happening. And then even beyond that, I'll jump quick and dive into, oftentimes because people are diagnosed based on vocabulary and observation. Okay, we use the word lazy, right? You're just lazy. Oh my gosh, who would want to make their life harder? Nobody. It's just like an addict. You don't wake up one day and say, you know what, I can't wait to lose my job, my family, my friends, my home. It doesn't work that way, right? So no one starts out with can't wait to get there. But we have to look at that individual's unique physiology of what's happening and really do the dive into what makes you uniquely you. One of my things, Chris, is that there's over 8 billion people in the world, billion different sets of DNA. Yet we treat everybody exactly the same and wonder why we don't get the results. I mean, it's been a failed attempt at what's happened up to this point when we talk about addiction. We're still practicing like it's 1950. Stop doing it. Oh, great. We would never say to someone who has diabetes, don't eat that piece of cake. You'd say, I understand, medically you have this disease. But with addictions, we find it okay to, call somebody a plethora of names. And you just want to be that way and you want to mess up your life. Nobody does. Nobody does. And why it even happens to begin with, oftentimes, is self-medicating, not even knowing that's what you're attempting to do. You just know, when I take this thing from the outside, whatever it is, be it alcohol, be it gambling, be it porn, whatever, you take that from the outside, you bring it in, your resting state changes and you feel good. And that works until it doesn't work. You're attempting to change this lack of or imbalance, lack of optimization, not even knowing that's what you're doing.
No, that makes a lot of sense. And it raises some interesting questions for me as well. And I often wondered this because as it was explained to me, when you have addiction, any kind of addiction in a family, then you're predisposed to having that addiction. But I guess my question is related more to, do you notice a difference in those dopamine receptors, and can we actually develop like a dopamine tolerance, and therefore we need to do like more and more exciting things to get that same sort of fix?
Absolutely. Yeah. And that's exactly what happens. You're always trying to chase that high that initially got you there. And again, you don't get to that point, but yet chasing, there's all the other layers of it. To look at just dopamine by itself, that's not enough. There's other genes that we have to look at. From example, there's always a co-occurring underlying situation, be it anxiety, depression, OCD, ADD, ADHD, whatever the case may be. There's always something that brings you to that self-medication point. And then we have life itself, where what's your environment? What have been your experiences? Are there traumas in your life that brought you to the place of self-medicating? So there's so many different layers. But just looking at those other genes, for example, the GAD1 gene, glutamic acid decarboxylase, its job is to convert glutamic acid, which is a stimulant, to GABA, which is a calming neurotransmitter. If we have an error in that genetic coding and we don't convert, we never get to the calm. So you say, well, why does drinking make you feel so good? Because I feel calm. Right? So rather than figure out what do we need to do with your unique biochemical pathways, we're like, let me just put this Band-Aid on and it works in this moment. Well, maybe for the first however many times you do that, and then it becomes your next problem.
And you raise an interesting question. And this is one of the interesting dichotomies, I think, when we talk about addictions too, is that you can actually become addicted to stress, to cortisol, correct?
Yep. So cortisol is our stress hormone, and you're saying addicted to what would kind of be like a good marketing stretch to say you're addicted to cortisol. What happens is cortisol follows the 24-hour circadian rhythm. So we should have our highest amount of cortisol in the morning when we wake up, because in theory, we've slept all night, our body is recharged, we're ready to go, should come down a little bit at noon, a little bit more in the evening as we wind down, and then the least at night. Well, when you're looking for that stress response, I feel most normal in a stress response because maybe I grew up in constant stress. Well, people used to say you're waiting for the other shoe to drop. It's that person, right? So you're like, I'm comfortable in stress because the chaos is what I grew up in. That's your trauma. So that's that piece of what all is involved, how many layers are involved with this individual. We have to look at the bio, the psycho, the social piece of every person, which is why addiction is so complicated, because everyone doesn't come in with the same situation. Physiologically, that's what we do. We look up what makes you uniquely you. So we have the starting point instead of throwing a dart and saying, I think they're really depressed underlying. I think they're really anxious underlying. We shouldn't be saying, I think. The technology has evolved to say, let's look at your unique makeup. Let's know your blueprint, Chris. This is you. Okay, now we can have an informed conversation and decision-making process as a result of that.
You said something really, really interesting there. And that's, makes me wonder, when you say depressed and anxious, I mean, you're pretty much describing, either effects of or withdrawal from those specific things as well. So, you're depressed. Well, I could say something pretty impolite here. Well, no, of course I'm depressed. I've been taking a bunch of depressants. Like, what do you want? Like, should I take stimulants or? And so what do? They give you a stimulant, right?
Right. And then even beyond that, one of the genes that we look at tells us with your unique DNA, would an antidepressant, an SSRI, even be effective for you? So there's incredible amounts of people that are on antidepressants and it's not even going to work for them. And you think about what this does emotionally to someone. We've seen people, Chris, that come to us after literally decades on an SSRI. First, was never meant to be used that way. Was meant to be short-term for an acute situation. Like life is really tough right now. Okay, take this. But we have people living on them and 10 years, 20 years plus on antidepressants and no better. And they go to their physicians. They're like, no, this works. This is you wanting to be this way. You need to figure it out and get over yourself. What that does to the individual when you tell them this is just you wanting to be you, emotionally destroys them. And if they were doing the deeper dive, they would know this was never going to work for that individual to begin with. We had to figure out a different way to affect what's happening with them.
And you mentioned that the technology is coming a long way, but I wonder if maybe some of the hesitation of doing something like that in normal practice is, I guess the length of time that it takes or the accessibility of the technology.
So, really it's a simple cheek swab, buccal swab, really easy, but it's more of physicians aren't trained in this yet. So like you practice what you know. And this is what I know. This is what I've been doing for my entire career. This is the way I'm going to do it. In science, it takes time for things to change. I mean, 25 years is like a nanosecond in science because it takes so long to be disseminated from the scientists to the clinicians to the people. So that takes a long time. But with things like a podcaster like you, Chris, with people having more access to information, makes these conversations happen that otherwise really wouldn't happen. And that's how a lot of people learn about things, like shows like yours.
No, you're absolutely right about that. I'm still fact checking a couple of things that people have told me, but it's really interesting that in terms of the medical profession, I think that there's so much out there that is not given. Like I was on with another physician just recently. They said that you're not taught nutrition in medical school.
Right.
That surprised me.
Yeah. It's surprising. It's wrong. It's nothing that would be good descriptors of it, because that's not how the model was set up. The model was set up for pharmaceuticals. And I'm not anti-pharmaceutical. I'm anti the abuse of pharmaceuticals, which is what has gone on. The reality is they save lives, and thankfully we have them. But it shouldn't be for someone. Let's use the example we were just talking about. Instead of the deeper dive, what's going on with your unique physiology, spend more time with you figuring out, tell me the layers of your life, all of these things. We say, here, take this. And we've trained society to say that, here, take this, give me this, and want an immediate change.
I mean, that sounds like a societal issue. One that I've always found is that, we're on that instant gratification train, right? I personally don't like it, but when I get sick, right, I have to actually pause and say, okay, I'm going to double up my vitamin D, my vitamin C, let's give it 5 days.
Yep.
And then we'll go.
Yep.
But before, I'll tell you before, and a lot of people do this, they get the sniffles, they run to the doctor, they get an antibiotic, and that's that. And the doctors will give them out too. So now, we've got bacterial resistant, antibiotic resistant, all sorts of different strains, or you took those antibiotics and you had a viral infection. So you're right about that. What do you think is kind of the biggest misconception when somebody's going in and trying to learn about their behavior and addiction?
A good question. Biggest misconception. I would say that they think there's going to be a single molecule solution to a single molecule problem, and it doesn't work that way. It's complex. There are so many layers, and to really get to the root of what you are physiologically, what your life has been up to this point, and take all of that information together to create a plan to move forward, that's a lot. That takes time. And the misconception is just go here, take this, or go to this place, and you're going to be better. And it doesn't. The results aren't there. It doesn't happen.
No, I get that. And we all want instant gratification and validation. And I think sometimes we're using these labels as identifiers, I guess, like you said, with the addicts and other things. And I think we're throwing them around sometimes superfluously. Like I always used to say that my grandmother was an alcoholic back in the 90s because she would have 2 glasses of wine, every day. And she'd get herself, her words were like pleasantly potted, I think were the words. But I mean, it got a little weird, right? Because it's like, well, is she an addict or is she not an addict? I mean, it's habitual. She always used to do it, but I mean, I saw days where she wouldn't do it too. So I mean, like, where do we draw that line?
So really, the definition, if you will, is when we get to the negative consequences, and despite those negative consequences, continue that activity. Right? There's even arguments over, is alcoholism, or we'll use that example, is alcoholism a disease? And by definition, a disease is any harmful deviation from the normal structure or function of an organism. So yes, that argument should just stop, because yes, that you have a deviation from normal function. But there continues to be the circle going around. Most importantly is understanding the uniqueness of you, and let's figure out you from your unique standpoint. I mean, personalized medicine is here. It is possible. And that's where we're going to see the changes.
So let me ask you this on a genetic scale. How impactful is genetics on that? Like, let's say that again, in my family, on my mother's side, my mother wasn't an alcoholic. My mother wasn't, she never drank. My grandfather, I'm not entirely sure if he did or not. My grandmother, I'm pretty sure she didn't. But, and my father's side, he didn't drink either. And yet, my mother would always tell me that we have a predisposition to addiction in the family. But I mean, realistically, how far back does that even go?
Yeah. Great question. And prior to this, that really was the only inkling. It would be like, you see Uncle Joe at the family gatherings and he always has to be walked out. That would be like the relative. Let's talk about the relatives and see if this is an issue for us and say, well, we've got a predisposition. Let's look at so-and-so, so-and-so, so-and-so. Now we can go beyond that. But the predisposition, when it comes to mental health and addiction, genetics do play a much greater role. So when we're talking about genetics overall, 10 to 33% of the picture. When we're talking about mental health and addiction, greater than 50%. So that's a big piece. And even to me, Chris, the best place, the sweet spot of all of it is when we have parents say, I've got a lot of this going on in my family, in myself. I don't want this for my child. Let's look at their unique makeup and let's then inform them of what's going on in their life. And I'll say to kids, I'm like, you're going to get to a point where your buddies at school are going to say, hey, we got a great idea. This is what we're all going to do after school today. And it's like, oh, okay, I'll do it. Next day, you're like, whoa, that was really good. And your buddy's like, no, we're not doing that today. We're done with that. Why are you sitting there like, no, that was really good? It's how you wire, right? So going into the game of life, this is really valuable information. You should know let me know these things. Let's use the example of breast cancer with the BRCA gene. Should you have a choice, right? Do you want to see if you have the BRCA gene or not? Then do with it what you will. But should you know that? It makes sense to know that. You still get to make your choice and play it out however you want. But should you know that? Yes, this is no different. You should know these things. And in our genetics, we all have strengths and we all have weaknesses. We all do. It's knowing what those weaknesses are and then what can we do about them. That's the whole point of epigenetics.
And, you mentioned environment plays a big role. Can the environment actually change those fundamental things?
Yes.
Or no?
Yes, absolutely. So that is epigenetics, right? Genetics. Here's your DNA. Here's your cards. Play them out. With epigenetics, we now know that what can change is the expression of your genes. So our environment can turn those genes on, turn those genes off. Why do we see behavior completely change in an individual? I'll say like a parent says, this is my daughter's 20 years old. I've never seen this behavior in her at all. Tell me about what happened between 19 and 20. Well, she went off to college. She's making her own decisions for the first time. She's doing schoolwork. She's doing university. She's trying to hold down a part-time job. She's making her own eating decisions. She's making her own sleeping decisions for the first time. And she has a whole new set of friends. Her environment has completely changed. That was always there. We didn't see it show up. So that's what knowing, the importance of knowing what you're made up of. Like, we're not seeing that now, and that's great. No, it's there. So know the decisions that you make and the environments you put yourself in can impact your genes.
So I guess the easiest way to kind of explain that is that we adapt based on the environment. I mean, like when the sun comes out, in my case, I burn, but most people get tan or different things like that, right? And I'm going back to the movie Deadpool, not just because, it does have a point. Their thing was to put stress on the genes to cause the gene to react or to activate.
So that's I didn't see the movie, but that's exactly what they were doing. That's epigenetics playing out.
Yeah, they put stress on it to turn on a different marker. Is that?
Yep, exactly right. That's how it happens.
Okay. So if somebody wanted to, I don't know, get over an addiction to something, you'd look at not only at the dopamine levels that they were getting, but also at the stress levels when they came off, and also for things that could be contributing to that or something similar that could do that?
So we would look at the neurotransmitters, dopamine being one of them, but you never just look at one because everything is a seesaw between serotonin and dopamine, seesaw between glutamate and GABA. You want to know the whole complete picture. So we would look at those neurotransmitters. Then we would look at those genetic biomarkers because they're going to impact what we have to work with. So it's all of those pieces.
No, it's just interesting to me as well because do those factors skip generations, kind of like color blindness as well, or are they just passed all along all the time?
They're passed along, and really the skipping the generation would really be from a scientific standpoint, looking at what was that person's environment. They might have had a very different environment, and we never saw it play out.
No,
it was always there.
Sense. No, that makes a lot of sense.
Mm-hmm.
And just doing into this with procrastination then, at least in your book, it's all about the dopamine, and we all process different levels of dopamine. I mean, there are people. So what would you say to someone who's getting the dopamine hit? They're what we would call a dreamer, right? So they plan these things out in their head and they're getting the dopamine just from planning it. And then they actually go to do it. And it's like, oh, well, yeah, no, I already got the dopamine I needed. Don't need to do anything. How do you approach something like that?
So really it would be like, let's take a look at what's going on with you on a physiological level. Let's measure these things. So we have objective information rather than subjective information, sounds like, looks like, and really zero in on you because life can get so much easier. It can get so much easier. Like when we talk about ADD, ADHD, one of the big biomarkers there is something called phenylethylalanine. Well, we have to have dopamine to be able to make phenylethylalanine. So you see how these things all tie in. You can't just look at one little piece and say, got it, because we're all unique.
Yeah, it reminds me of that saying, just remember, you're unique just like everybody else.
Yeah, exactly.
No,
that would be a t-shirt. It's funny. Yeah.
No, yeah, I think it is, and a bumper sticker, among other things.
Yeah.
When we were talking about addictions, and we talked about this before, like the stigmas and things, right? What do you think is the biggest maybe misconception when it comes to maybe helping, say, a family member or someone else with an addiction that you can see?
Great question. I'd say the first part is understanding they're not just trying to be opposite and be this way. Understand with compassion, if possible. I understand people get over it. Like, depending on the level of what's happening, the intensity of it, but understanding that physiologically there's something going on. And if somebody had cardiovascular disease, we wouldn't be like, why did you have that heart attack for? You really ruined my day. I had plans and I had to go to the emergency department. We would never look at it that way. So understanding, and to me, if you can understand the theory behind something, you can think it through. Right? So understanding that this is someone's unique physiological makeup. This is their unique self. This is who they show up as. So that's their starting point, not your starting point. So don't do the comparison. Don't do the yeah, buts. This is where they're starting. Let's get help and remove that shame and stigma of you're weak, you're lazy, you're all the things that go along with it. It removes all that. And it says, let's figure out what you're made up of, because we're not the same and nobody's the same. Nobody on the face of the earth is the same. So let's see what's going on. And then once we identify that and we know it with objectivity, okay, let's go. Where do we go from here?
So what does that process look like with you? Somebody decides that we want to,
Right. So we drop ship lab kits literally all over the world. Do your samples. We get that back to our lab. Takes about 10 days to get it completed. Then we create a biomarker evaluation report. We go over each one of those 85 different biomarkers and say, what's the clinical correlation of each one of those? And then what's going on? For example, when we're looking at the DNA portion, is there no clinical abnormality there? Is there an error in one of the pair? Is there an error in both of the pair? What's the impact of that? Then most importantly, what are we going to do to change it? by looking at those biochemical pathways. What do we need to do to optimize that biochemical pathway uniquely for you?
Let me ask you maybe a little more difficult question. I get this sometimes from people. They say that, so-and-so says I'm an addict or I'm addicted or whatever the case may be, whether it be, like we said before, whether it be alcohol, cigarettes, porn,
Right.
food,
Right.
sleep.
Right.
How does someone know in lieu of, because one of the definitions you gave before with addiction is that it's from the norm and you're having negative consequences. What if you're not having negative consequences? How can someone tell if you're addicted?
Differentiate. That's a really good question. If it's not negatively impacting your life from the standpoint then of where would that go? Is it, say, using the example of exercise? People say, can you be addicted to exercise? And I'm like, if it's negatively impacting your life, yeah, you can overdo to the point of you're having injury after injury. It's ruining your relationships because you want to be doing your thing 20 hours a day. It's changing all your patterns of living. Yeah, that's something that's good. That could become an addiction.
So, but I mean, in so much as like, if it's not creating any havoc, I mean,
not impacting negatively. Yeah. Then it's part of your process. I mean, then I guess you could get into the morality piece of things. Someone says, well, if the porn, because my spouse hasn't found out that's what I'm doing, it's not negatively impacting my life. But the day your spouse learns, we get the calls. And all of a sudden, but it is impacting because you got caught. So it's all the different pieces of it. It's looking at the unique, we call those process addictions, the gambling. Gambling wasn't a problem. You see the alcohol on somebody, you see they're disheveled now. They're not showing up to work. We see the outward appearance. The gambling we may not see until, whoa, now I have to say, we've lost our home. Was it a problem the whole time? Yeah, but you didn't see it the same way.
So definitely just being curious and knowing yourself, I guess.
I was just going to say the old William Shakespeare, to thy own self be true. Absolutely. I call it the honesty inventory. You don't have to tell me you're doing good things or not because it's your life that's being impacted, not mine. So being true to yourself, being honest to yourself.
And I mean, and here's another hard one I'm gonna ask you for sure too, because this comes up a lot, especially with family members, well-meaning family members. When somebody is in the throes of that addiction, is it better to wait until they kind of hit that rock bottom where they kind of say that they kind of come out and they say that they want some help before you try to approach them? Or do you try to, gently wheel it?
Yeah, that's a good question, Chris, because typically it's the family members who are more all in initially. But if the person who needs the help isn't going to do it, you're climbing an uphill battle. It's not going to happen. But they'll say, then what do I do? I'm like, share something like Chris's podcast. Share this information. Say, just give it a listen. Do you feel like this is something that could help you? If you're spending time in your day saying, I'm not going to say this to anybody, but I'm kind of concerned I might have a problem. I spend way too much time thinking about when I get out of here, this is what I'm going to do. So in that being honest to yourself, best place is, you know what, I'm thinking about this. Let me take a look at this. Or have the family member say, just listen to this. Give it a listen. And it removes the shame, the stigma. It's like we all are wired the way we're uniquely wired.
I like that. As you're talking here, it brings me up to one of my final questions for you, which may be easy, may not be easy. I'm not even sure how to describe it. I guess it'd be like a covert addiction or a ghost addiction.
Okay.
And what I mean is like how you were saying just now, like I can't wait, 30 seconds, and I can't wait to be out of here in 30 seconds. So I'm going to go get a drink, or I'm going to go have a cigarette, or I'm going to go do whatever.
Whatever. Right.
But can you be addicted to that? Can you have an addiction that doesn't exist, but you're still thinking about it all the time and it can still have that detrimental effect?
That'd be a psychological addiction. Yeah, you're spending way too much time thinking about this. But then even the psychological piece would go back to, let's look at what your makeup is. Because why is that even happening? For you to have a thought, physiologically, things are happening in your body to then make the thought happen, to then make the occurrence of the action happen.
And so those different triggers, I go back because it'd be interesting. I might want to pick up hey, can you do a post-mortem on addictions, or does it have to be in the moment?
Absolutely. Yeah, absolutely. I mean, we've seen a lot of people that it's like, man, you've been white knuckling it because you just done I'm not doing this, I'm not doing this, I'm not doing this. And your physiology is hurting. You know, your life could be so much easier. Yeah, we see people like that for sure.
And is there ever a time where they say, you don't quit cold turkey, you just keep doing that, but then it's not an addiction, it turns into a guilty pleasure?
Yeah. And I'll just bring it back to the same thing I just said. It's like there's something going on within your makeup that has you going to those thoughts all the time. You're white knuckling it.
Well, Evelyn, this has been a really great conversation. I could probably go on for another like 6 hours like this because it's a topic that's so big and well, I think it's needed because we don't talk about it a lot for sure.
Absolutely.
We are coming up pretty close to the time though. Is there anything that you feel I should have asked but didn't ask, or?
No, I think you handled it really well, Chris. I think you asked all the important things. And I'd like to thank you for doing this podcast because this is how people can get information. This is how, example that I said, like you're concerned over someone, just give a listen to Chris's podcast. This might resonate with you.
Excellent. Well,
yeah. Or for somebody that directly it does is like, wow, my life doesn't have to be as hard as it is. That's why we're here.
Excellent. Love that. Love that. Just before we go then, what is the best way for our members to reach out to you?
Sure. Probably our website. We have a toll-free number that's 888-841-7099. You can call that. Or if you just want to say, let me take a look at what's on there, go to the website, wiredforaddiction.com, wiredbiohealth.com. Take a look at that, wiredforaddiction.com. Look over everything. We even offer 15-minute consultations with our clinicians to say, hey, this is going on with me. Do you think it's something that would help me? This is what I've done so far. This is what I haven't done. Absolutely use that resource. And we created Wired Biohealth because a lot of people came to us and said, I'm not quite at the addiction side of things, but I know what's going on with me isn't right either. And we created that arm. So yeah, wherever you are in that spectrum, you know, Chris, I always say health is more than the absence of disease. And we're not healthy one day and sick the next. It's all the living that we do in between that brings us to either end of that spectrum. So wherever you're at, you know, feel free to use us as a resource. Reach out.
Love that. Thanks so much. And to all our listeners, don't worry about grabbing a pen and paper. We're going to have those in the show notes for you, so it'll be easy to find. Once again, thank you so much for being on the show today, Evelyn. Really enjoyed the conversation. A lot of great information. And to all our listeners, you know, thank you for tuning in once again. And just remember, if you can't find that motivation or inspiration for yourself today, maybe just go out and try to be that motivation and inspiration for someone else. And we'll see you again next time.